We're diving into Streptococcus, a group of bacteria that causes some of the most recognizable and high-yield diseases in veterinary medicine. These organisms are fascinating because they're highly host adapted. Each species tends to have its own preferred animal host and its own signature disease patterns. By the end of this session, you'll have a clear framework for which streps matter in which species, how they cause disease, and how to diagnose and manage the infections they create. This is one of those topics where, once you understand the patterns, everything clicks into place. Streptococcus are gram-positive cocci that form chains. That's the classic morphology. They're facultative anaerobes and tend to be more fastidious than staph, meaning they grow best on enriched media like blood agar. A key point: many streps are normal flora of the upper respiratory tract, lower genital tract, and mucous membranes. So, just like with staph, isolation alone doesn't always mean disease. You have to interpret culture results in the context of clinical signs. Are classically grouped by their hemolysis patterns on blood agar. This is one of those foundational bacteriology concepts that shows up everywhere: boards, clinics, and lab interpretation. Beta hemolysis is complete clearing around colonies and is often associated with more pathogenic species. Alpha hemolysis gives that greenish discoloration. Gamma means no hemolysis at all. These patterns help you narrow down which species you're dealing with before you even get to biochemical test or MALDI-TOF. These are the big players in veterinary medicine. Streptococcus equi subspecies equi causes strangles, one of the most iconic equine diseases. It's highly contagious and produces those classic abscessed lymph nodes. Streptococcus zooepidemicus is more of an opportunist. It's normal flora in horses, but can cause severe pneumonia, uterine infections, and wound infections when given the chance. In cattle, Streptococcus agalactiae is a major cause of contagious mastitis. It spreads from cow to cow during milking and can cause significant production losses. In pigs, Streptococcus suis is a huge deal. It causes meningitis, arthritis, septicemia, and sudden death, especially in young pigs. And in small animals, Streptococcus canis is the most common species. It can cause skin infections, wound infections, and occasionally severe systemic disease. This is one of the most recognizable diseases in horses. It's caused by Streptococcus equi subspecies equi, a highly host-adapted pathogen. The bacteria target the lymph nodes of the head and neck, leading to swelling, abscessation, and drainage. Horses shed the organism in nasal secretions, and it spreads rapidly through barns, shows, and training facilities. One of the biggest challenges is carrier animals, horses that appear healthy but harbor the bacteria in their guttural pouches. These carriers can silently reintroduce the disease into a herd months later. Because agalactiae is a classic cause of contagious mastitis in dairy cattle. Unlike environmental mastitis pathogens, this one spreads cow to cow, primarily through contaminated milking equipment or poor milking hygiene. It causes elevated somatic cell counts and decreased milk production. The good news is that with proper milking hygiene, routine screening, and targeted treatment, herds can eliminate this pathogen entirely. Many modern dairy herds are now free of S. agalactiae thanks to these programs. Streptococcus suis is one of the most important bacterial pathogens in swine. It causes meningitis, arthritis, pneumonia, and septicemia, especially in nursery pigs. Clinically, you'll see pigs that are febrile, off-feed, and sometimes paddling or showing neurologic signs. Mortality can be high if outbreaks aren't controlled quickly. It's also zoonotic. People working closely with pigs can develop severe infections, including meningitis. So biosecurity and personal protective equipment are essential. Streptococcus canis is the most common pathogenic species. It's part of the normal flora but can cause disease when the skin barrier is compromised. It's often isolated from wounds, abscesses, and soft tissue infections. In neonatal puppies and kittens, it can cause septicemia, especially in crowded or stressed environments. There are also rare but dramatic cases of toxic shock-like syndrome where dogs develop rapid, severe systemic illness. These cases require aggressive treatment and supportive care. Cocci have several virulence factors that help them evade the immune system and cause disease. The M protein is one of the most important. It prevents phagocytosis and helps the bacteria adhere to host tissues. The capsule also protects against immune clearance. Hemolysis contribute to tissue damage, and some species produce superantigens that can trigger massive immune activation, leading to severe systemic disease. Diagnosis usually starts with culture. Hemolysis patterns give you early clues, and Lancefield grouping can help identify species based on cell wall antigens. PCR is especially useful for Streptococcus equi, both for diagnosing active infection and identifying carrier animals. Cytology is less definitive than with staph because streps can be harder to visualize and interpret, but it can still support your clinical suspicion. Streptococcus species remain highly susceptible to penicillins, which is great from a stewardship standpoint. Beta-lactams are usually your first-line choice. Avoid broad-spectrum antibiotics unless culture results indicate resistance or mixed infections. Supportive care is essential for severe cases like strangles or suis meningitis, and for contagious species, biosecurity measures, isolation, hygiene, and environmental control are critical to stopping spread. Streptococcus species are highly host-adapted pathogens that can cause some of the most classic diseases in veterinary medicine. Understanding which species matter in which host, recognizing the importance of hemolysis patterns, and using targeted diagnostics will help you manage these infections effectively. And the good news is that penicillins remain highly effective for most streps, making treatment straightforward when you catch infections early. If you found this video helpful, please like and subscribe. Thanks, and I'll see you next time.